All right. I'm going to leave this to Dr. Simone Moody here in a second, but just wanted to welcome everyone. I am going to record this so that if anyone doesn't get a chance to watch the whole thing, they can come back and watch it, and I will blur everybody's face except for the speaker, but just to kind of warn everyone. And if everyone can please stay on mute unless you're talking, and if you have a question, ask in the chat box, and then I will alert Dr. Moody to the questions so that we can keep the background noise limited. All right.
Okay, well, I am Dr. Simone Moody, and then I'll let Dr. Perez Crawford introduce herself.
Hi, I'm Dr. Perez Crawford, a psychologist also at Children's Mercy.
Yes, we are both psychologists at Children's Mercy, and we're here to chat with you today about going back to school after online learning. Okay, so I'll just go ahead and jump in and get started. We have about 25 minutes of presentation planned today where we will discuss what we know about school reentry, what we don't know yet, what to expect, and then finally what you can do. We wanted to make sure that we saved about 15 minutes at the end until our Zoom call cuts us off to be able to answer any questions that you may have. I do want to give a disclaimer that information in this presentation is subject to change as we learn more about COVID-19 and its effect on our community, and I'm sure you all are used to that statement already. So first, I'll start with what we know. So back in May, the Center of Disease Control and Prevention came out with guidelines for schools to reopen safely, and they were pretty detailed, and it received a lot of attention, lots of questions about feasibility of these plans as we go back to school. And then there was a little lull in the going back to school talk, and in late June, the American Academy of Pediatrics came out with a statement that strongly recommended in-person education, and they also offered later some guidance on school reentry, and they released some considerations specifically aimed at schools, and then another document, the second bullet point here, that is aimed towards families. Shortly after that, on July 10th, which was just this last week, the American Academy of Pediatrics teamed up with the American Federation of Teachers, the National Education Association, and the School Superintendents Association to release a joint statement on their position on school reentry. And I typically don't read straight from slides, but I think this is really important for you to hear, so I'm going to do it. Returning to school is important for the healthy development and well-being of children, but we must pursue reopening in a way that is safe for all students, teachers, and staff. Science should drive decision-making on safely reopening schools. Public health agencies must make recommendations based on evidence and not politics. We should leave it to health experts to tell us when the time is best. Whoops, hold on, my screen is best to open up school buildings and listen to educators and administrators to shape how we do it. And then they go on to say, for instance, schools in areas with high levels of COVID-19 community spread should not be compelled to reopen against the judgment of local experts. A one-size-fits-all approach is not appropriate for return to school decisions. So I have a link to the full position statement here in case you are interested. But moving on, in a nutshell, what we know is that school might look different depending on your district that your children are in, and the status of the pandemic in your area, in your county. And these are things that are all out of our control, and these are things that make us feel uncomfortable and maybe bring about some anxiety about returning to school. But there are some things that we can control. So many area school districts have discussed this sort of option for virtual learning or in-person learning, and leaving it up to parents for the most part to choose what might be a good fit for their children. The American Academy of Pediatrics, again, strongly advocates for in-person school if it's safe, with some key considerations, including for children with special needs. And the reason for this is that we know that children have a lower risk of infection. They tend to have milder infection, and they are less likely to transmit the infection. And then we also know from the end of the last school year that school closures can negatively impact child well-being. So that's where their position comes from. However, we need to think carefully and weigh our options. So I'm just going to go through some considerations as you are thinking about virtual versus in-person school for your child, with a specific emphasis on kids with ADHD. My specialty and Dr. Perez Crawford's specialty is on ADHD. Most of the patients that I see have ADHD, and so I've had a chance to get a lot of clinical experience in this past several months or so, it feels like, with children and virtual learning. And what I found is that some children did exceptionally well and some did not. And I'm see Dr. Perez Crawford nodding her head over there. And I'm wondering if some of you would share in the chat why you think maybe some of your children did exceptionally well.
See what we see in the chat.
Yeah, thank you.
Well, and while we wait on parents, I can comment some on this. I have some kids who had some school anxiety prior to COVID happening and had a really tough time, or even social anxiety, being in the large group setting. And so them being able to have more individualized learning, being in a more calm environment and learning at their pace was really a successful situation for them. Also, some of my kids that had a really hard time focusing, even with their Section 504 plans, they did really well because there were fewer distractions at home, even with siblings, believe it or not. So it's just a more controlled environment. However, that was not the case. I will say for the vast majority, that was not the case. It was a small subset of the kids that I see that responded really well to virtual learning.
Well, thank you for your contribution. Did we get any other contributions?
I didn't see any in the chat.
Okay.
No.
Well,
I
agree with Dr. Perez Crawford's what your points were about some kids maybe being a little bit more anxious and their anxiety going down when they're home at school. I also noticed that the expectations weren't particularly high for most of the districts. They kind of put things together, maybe obviously a little last minute, and kids were able to get some more free time to do the things that they like to do, like play video games and do other hobbies that they enjoy. However, some kids, especially those with significant learning challenges, other comorbidities or special needs, they really did struggle, or the ones who are super high in their disruptive behaviors. So really thinking about, how did your child do this the last quarter of school, and seeing and having that weigh into your decision. However,
we did get one comment, Dr. Moody.
Yeah,
one parent noted that her son did well because he also had school anxiety, but he was very bored as well. The work they were given didn't keep his attention. We heard that a lot. It was either way too easy or way too difficult. I think finding that sweet spot was what was challenging. And so, yes, you bring up a good point. Thank you so much for your input.
Yeah, and it was really hard for teachers to even be able to tailor the material that was coming out, because some of the districts just had standard material and the teachers were just to check in to see how the children were doing on that material. So they didn't really get to personalize it and individualize it for each student. So it makes sense that some would be too hard and some would be too easy. Looking more at school district insight, what I'm hearing is that school, if it's virtual, will be a lot different than it was last year. Some districts have invested in programs to help with virtual learning. There's going to be higher expectations. It's going to be, likely you're going to be required to be there. There's going to be an instruction period. There are going to be frequent check-ins. And so considering your child having to focus more and less flexibility in what school looks like going into the school year is really important to consider. ultimately it's a family decision unless the health experts in districts tell us that we can't be in person, right? And so we need to individually with each child and family weigh the risks and benefits of either in-person school or virtual learning. Reach out to your pediatrician if needed, if there are any questions about health risk. Determine if you are prepared for at-home school. So for children with ADHD, because of their challenges, for the most part, they're going to need more one-on-one support, more monitoring, and more accountability checks to be successful. And so I would envision most of the kids that I see for virtual learning in an ideal world being in a room, sitting next to their parent for the most part, and working so that parent can pay attention and give that child feedback about their behavior and their academic performance. I've seen it work really well where a parent is in the room working from home and the child is doing their schoolwork, and the child, when they're doing independent schoolwork, wears noise canceling headphones. I've seen that model work pretty well. Okay, I will pass it along to Dr. Perez Crawford to talk about what we don't know.
So things that we do not know yet, masks or no masks. So I will say from looking at the vast majority of the Kansas City metro area schools, most are planning to require masks. Interestingly, just today, Orange County School District in California decided that they are proceeding with live school without masks because they said that it will be too difficult to monitor having all of the children in the school district to wear masks. But from what I can tell from Kansas City so far, that will be a requirement. And with that, I have recommended the families that I work with, especially if you know your kid has some sensitivity to wearing the mask or has been uncomfortable by it, start doing it in small increments of time now, just to kind of get them used to what it feels like to wear a mask and what it could feel like to wear it for longer periods of time. Trial some different masks, the paper ones versus the cloth ones, because certainly everyone has their own sensory preferences, in addition to sensitivity sometimes. But from what I can tell for the vast majority of the school districts in our area, it looks like if there will be any live school, there will be masks worn by both students and teachers from all grade levels. Oops. Sorry, Dr. Mooney, can you go back?
Oops, sorry.
Okay, social distancing in the classroom. This has been a really interesting topic because there has been many discussions about what we need. The American Academy of Pediatrics has said as little as 3 feet of space could be sufficient for the school classroom just because of the nature of the environment and how learning is taking place, with reduction of things like community supplies. So no more sharing pencils or scissors or crayons. Each child would have their own individual tools and materials to use during the day, but they could be spaced 3 feet. If they are looking to do more 6 feet because we're more concerned about community spread, that could limit the number of students in a classroom to about 16. And so that would necessitate having potentially like a block scheduling where kids would go on certain days of the week. And what I've seen is several of the school districts, North Kansas City, Shawnee Mission School District, they have already started making drafts of what these plans will look like. So one plan being all of the students present Monday through Friday for the entire day. And then if we're needing to get 50% capacity in the school, so that would likely be more like the 6 feet-ish space between students, then having block schedules for that. And if we needed to reduce from there, they've come up with plans for that as well. This is changing literally to the day. The plans from Shawnee Mission and North Kansas City were from the end of last week, and I imagine will continue to change up until August. Social distancing. Yeah. Oh, go ahead.
To chime in really quickly, the governor is holding a press conference of Kansas is holding a press conference at 3 p.m. tomorrow to discuss Kansas guidelines, which again are subject to change. But if you're interested, you can tune into that.
And I highly recommend, for whatever your school district is, continue to check your website daily. Many of them are updating. I know Shawnee Mission was planning to do live graduations, but that has since changed to virtual graduations for this week. So again, things are changing at the drop of a hat. So I think as much as possible, just try to stay up to speed on what your particular district is, because what your district is doing, because they're all so different. Social distancing in communal areas. So it seems to be that the schools are agreeing on this point, that things like lunch in the cafeteria, changing classes at the same time, recess with the entire grade, those are going to be things that are not going to look the same coming back to school in August. So many of the schools are talking about having kids eat in the classroom, having students arrive at different times and leave at different times, so that there would be fewer people coming through the doors and the hallways at the same time. And then instead of students switching classes, having teachers to switch classes, so that there's just less movement between the students. And then, as I mentioned, alternating school days. So certainly that can get a little bit confusing. So schools have been thinking through things like using the letters of your last name to determine what days you will come, so that your entire family could be on the same day, and so that people could get a schedule, because again, this would be problematic for parents who work, because they're going to need to figure out childcare. So these are all areas that are changing constantly as the COVID picture in our communities is changing. So like I said, number one, please, please, please stay on your school's website and make sure that you know what your school is doing. If you have questions, there's always a phone number or an email address that you can use to reach out to your school, and just start thinking through what the different scenarios could be for your family. And what to expect. So with this, there's going to be an in-school adjustment period, or if there's a virtual learning environment again, there's going to be an adjustment period to that. Many of the kids that I work with are eager to go back to school. They are bored. They want to see their friends. They want to interact with other kids, and that makes perfect sense. And so this whole time has been really difficult for them. However, if they go back to being in school, you have to keep in mind they haven't been in school since March. So getting back onto that routine, little things like going to bed at normal times, waking at normal times, being on or ready to learn for such a long period of time, when many of them have not been doing that for several months in a longer period of time than they're typically accustomed to. We know that there will be an adjustment period. So I would expect that there's going to be some pushback with bedtime, with wanting to get up to go to school, with wanting to do schoolwork, with focusing on tasks, with completing tasks. So go ahead and be prepared for that. We love daily report cards. That's one of our bread and butters with kids with ADHD. So looking for now ways that you can reward or motivate them putting forth that effort in the classroom would be great. With that, I also expect that there will be more disruptive behaviors. The kids have been at home since March, and so they are ready to get back to their friends, and that may also mean that they have created a situation where they want to be class clowns or entertain one another and get all of the fun stuff out that they didn't get to share when they were at home. So I fully expect that there will be more of the disruptive behaviors in the classroom. And just with all of the changes, kids know what's going on too. And so we want to test the boundaries to see what we can get away with in this new COVID system. Along those same lines, we'll have some kids who may have more anxiety. Some kids have been more anxious just hearing about COVID-19 and everything that's going on in the communities. Some kids already had social anxiety and school anxiety, as I had mentioned earlier. And so going back to school will just likely heighten those kids' anxiety symptoms. And so we need to prepare for that. again, this is one of those things where we don't want to wait until even August. Like, go ahead and start talking about these things now so that we know that we have good plans in place before we get back to the classroom. There might be some social awkwardness. Who has had the experience of trying to connect with people with a mask on and felt like really strange? Yes, I'm a smiley, happy type person, but when I have a mask on, you can't see that. So then I feel like I have to like Tyra Banks smile with my eyes, and that can be hard to do, or I have to be even more expressive, and it can just feel weird. Or where I would usually shake someone's hand or give a hug, I have to take a step back. I'm not supposed to be doing that with social distancing. So just like we as adults are experiencing it, kids are experiencing it too. And I especially go to our like teens and tweens. They are so into hugging their friends, high-fiving, fist bumping. So it's going to be a really huge transition for them to not be able to physically interact with their friends. And so I fully accept that there will be social awkwardness. And then when you add ADHD into that, I'm sure that we will develop some games where, they try to hug behind people's backs or high five when people aren't looking, because it's funny, right? So, just be prepared for all of that. In addition, the schools recognize, as well as parents have experienced since March, that there will be an academic slide. There's always an academic slide for kiddos over the summer, which is why we often encourage just try to do some type of academic task, be it reading books, or if you have little workbooks for their grade, all of those things are helpful. But this particular year is going to be very different because many of them have not had the instruction that they were used to since March. And so what I've noticed from most of the school districts is that they've planned that into the curriculum, and the first few months of school will involve relearning or reteaching the material that they would have learned from March on to the end of the school year. And so, that will take some time. And for kids who already had academic difficulties, it's very likely that they're even further behind than their peers. So we will need to be very patient as we catch all of the students up to where they would have been had they been in school during the last semester. And as Dr. Moody mentioned, I think all of the schools have been spending more time on this academic piece because we're not sure if we're going to have 100% live school or if we're going to wind up doing virtual school. So they're making sure that the academic competencies are in place and really working to have a little bit more individualized plans for kids to address any content areas that the child may specifically need after having been home. So go ahead and expect that, and expect to have to spend a little bit of extra time practicing the things that they've done at school or the things that they've learned if they're having some trouble with that. Along those same lines, our kids with IEPs were some of the ones who had the greatest difficulty during the stay at home because they're used to getting individualized learning with a special education teacher, and that was very difficult to maintain during the stay at home time period. And so it is very likely that they may not have met their benchmarks for the last quarter or whatever time period was for their last set of goals. So it will be very important for parents of kids with IEPs to communicate with the special education department and with their teachers to make sure that we're not just pushing them to higher goals faster than they're ready to progress because they haven't received the support that they need. So we have our hands full for this upcoming school year. And I think as much as possible, planning ahead for that will help us to be successful. And Dr. Moody is going to talk about what we can do.
Okay, thank you, Dr. Perez Crawford. So I'll just jump in, and some of this we already touched on, but it's really important to emphasize that we need to prepare our routines now. So we're about a month out until the start of school. Typically, I'll tell families to start planning for back to school about 2 weeks before, but we're going to need some extra time. Like Dr. Perez Crawford said, it's been a longer gap since they've been at school in person. And so start now, start planning family meetings to discuss expectations, create new routines. And you may have an initial visit now, and then set up later visits as you get more information about what the school year will look like. Sleep is super important for behavior, for emotional functioning, and especially for ADHD. And I will say that 90% of my kids, maybe even more, are going to sleep significantly later and waking up significantly later. Even the ones that like are on the dot in bed at 8:30, they're, staying up till 10:30. So making sure that we're gradually shifting bedtime and wake times. Start with 15-minute increments. This way you won't get as much pushback from your kiddos when you tell them you're doing something differently. Or you can be really sneaky and change the time on the clock. But I always encourage honesty. Also considering regular eating times. So I've seen this too, as bedtimes and wake times have shifted. So have eating times, or we're not paying attention because we're playing Fortnite, or, we are engaged in something that we want to do. A lot of kids that I see that are on stimulant medications, we're concerned about weight gain, making sure that they are shifting their eating times, working on eating something for lunch if they're on stimulant medication. And that they're eating in an efficient manner, because we know that school lunch periods are pretty short. And then scheduling some time to start practicing academic work, even if it's just a few problems a day at first, or maybe some quiet time. This will also help your mental health, but have them adjust to being a little bit more independent and focused. Moving on, talking about practice, health, and safety measures that you can do. Dr. Crawford shared that most school districts will likely have someone wearing a mask. So I would say definitely probably teachers and staff. I've heard, probably most likely for older students, high schoolers and middle school. And then I saw recently in like a sneak peek at the Kansas guidelines that they're going to leave elementary students wearing masks up to the local health experts. So, and again, subject to change over time. I would just practice regardless. Dr. Crawford touched on comfort. Also, you can make it fun too. So for younger kiddos, doing pretend games, pretending to be a superhero, making it like a family challenge. If we can wear a mask for 5 minutes, then we can dance to our favorite song, or we'll go out for a walk. Just really trying to engage them, and then gradually increase the amount of time every day. Physical distancing, we know that our kiddos with ADHD have trouble, many of them with personal space. So making sure that we are, if you've expanded your bubble to maybe include neighbor friends or cousins, close family members, how can I give my child gentle corrective feedback that maybe they need to change their behavior a little bit to make it safer for when they return to school? So letting them know, making them aware that maybe they're not doing a great job with physical distancing, and what can I encourage them to do instead while they're at home right now. Also practicing hand washing. So Dr. Perez Crawford and I, we direct a summer camp for kids with ADHD, and after they go to the bathroom, they have to wash their hands. And I mean, they're just going, that's one of the rules, but they're going quickly, right? They just want to get it done. They want to get back to the fun. So really making sure that you're engaging them, that they're washing their hands appropriately, and practicing that now. Some more tips and tricks. So we're already starting to gradually receive plans from local districts and states. And you may be in favor of those recommendations and you may not. But I think it's important to really model a calm and accepting attitude, regardless of what you're feeling on the inside, because you have little ears and little eyes, or maybe they're big ears and big eyes by now, but they're looking to you to see how you react. And that will affect their adjustment to school. If they are mad about the changes, if they are worried about what a certain policy or procedure is going to look like, then it will make it harder for them to adjust. So start at the parent level, the caregiver level, modeling acceptance. And then Dr. Perez Crawford touched on this already, but using your behavior skills to teach them new skills that are in line with the policies and procedures. So for example, when you see your child, when you're practicing wearing your mask, lots of praise and attention for them practicing. For some kids, we know that about half of kids with ADHD also have disruptive behavior or defiance. I'm sure you're all nodding your heads at home. So for those kids who maybe are refusing to practice, you may need to offer a little bit of an incentive to get them going, a small privilege or reward. And then also, we touched on this a little bit already, reaching out to the new school or the new teachers or teacher to let them know, and I encourage parents to do this every summer, but it's especially important now, to introduce your child, let them know what their strengths are, what their areas for growth are, what they respond well to, and if you have any concerns about how they will adjust to the policies and procedures, because potentially if they can anticipate that at the school, they may be able to make certain accommodations or find ways for you to help prepare your child further at home. Maybe they can incorporate benchmarks into their IEP about wearing their mask or maintaining appropriate social distance. And then last but not least, remember your team. So your child is important. Your child has probably many members of their team that help them function, including their pediatrician, potentially mental health professionals, other supports that keep them going. And these are the people that can help support you as you're transitioning and help you help answer any questions or just listen to any concerns that you have. Okay, it is about time for Q&A. So please
yes,
submit
if
your
you
questions.
have questions, yes, put them in the chat and we're happy to answer them, or even if you want to talk through your thoughts about all of this, we are happy to share.
And as we're waiting for questions, Dr. Steppe, will we cut off at 40 minutes?
No, we're good.
Okay,
Yep.
Gotcha.
I guess I'll ask a question if no one else is going to, because this is something that has come up in kids that I've spoken with that are hesitant. They got comfortable staying home. They like staying home. They have social anxiety, and they are excited to go back to school, but they're worried that it's going to be start school, go back home, start school, go back home, that kind of transition back and forth, not just one transition, but multiple transitions potentially. And what would you say to help them out?
That's a really great question. And again, one of those things that's under our control. I think that the school districts and the health experts are trying to work, and which is why it's probably taking so long for them to figure out what to do, because they want to make a decision where they're not going to have to go back and forth. But as you know, things may change, and I think we need to be prepared for it. And so if you can anticipate that your child is going to have a hard time adjusting to that, what helps them in their transitions typically? And are there ways that I can make my child feel more comfortable if we have to change all of a sudden? So just sort of learning from your experiences, maybe specific to the virtual learning and how they did with that transition, or just to transitions in general, to see what you can do to help them. And maybe it's just talking through, well, if we have to stay home, here's what it's going to look like. If we go to school, here's what it's going to look like, and just letting them know a little bit to remove some of that uncertainty.
I agree with Dr. Moody, and I would say also trying to make the at-home environment and school environments as similar as possible. So even if you know like what their schedule will be at school, try as much as you can to mirror that schedule to lessen a little bit of the drastic changes between the environments. So, you know, if they're practicing math in the morning, you practice math in the morning. If you know, this is a time that your class is meeting all together, then you also be meeting together. And in some of the models, there's students who will be doing blended live and virtual. And so even in those situations, it may be a little bit easier because you'll have instructional time with your class and then time to do your work. But with anxiety, the best thing that you can do is practice in the moment. And then in those moments, also practicing relaxation techniques. And so having time away from school to do calm activities, be it coloring, drawing, playing with Play-Doh, you know, any projects like that that can help them decompress after the stress of school is also a great idea.
Okay, I'm going to stop sharing my screen so potentially we can take a look here at some of the questions. I
Anybody
don't think
else
we
have
got any questions.
questions? The whole thing is a big question. Okay.
Any other questions or something that you'd like to hear us speak more about that we didn't go into in detail?
Oh, here's one. My son has become a homebody since COVID came about. He is really fighting going back to school. He says he just wants to stay home. Do you have any suggestions to get him more comfortable? So definitely, this would be one where, and it is tricky because we can't really go many places, but building up a routine where you do go out of the house, if it's even walks, those are good things. Getting on a schedule so that your son knows what to expect each day. Having a routine schedule helps kids with ADHD. It helps people with anxiety because then you know what to expect. And again, trying to find those activities that he enjoyed or liked about school and really highlighting those and finding ways to incorporate those into his schedule would be great. Even if you're going to the store or things like that, he can ride along in the car. Right now, because we can't go as many places, I think it's important to just make sure that you're leaving the house, even if the goal is to not go into many public places, because what happens for kids who have anxiety and stay home all the time is we just really reinforce their feelings of needing to stay at home to be safe. And this is a whole big tricky situation because that's what we're hearing in the media about COVID is stay home. That's the way that you stay safe. But I would caution you as much as possible, if you have an anxious child, really be vigilant about the news that you're playing and things that they can hear, because a lot of times the news is extreme and it can just heighten some of those feelings of anxiety. So if you can read your news instead, that might be helpful so that they're not picking up on some of these messages as well.
And I can touch a little bit on the disruptive behavior standpoint. So some of the kids that I'm seeing, they don't want to go back to school because they're having a great time at home. They're doing things that they like. So maybe if this rings true for you, taking a look at what is your child doing at home all day, and how can I maybe limit that really reinforcing time, gradually incorporate, like Dr. Perez Crawford said, just some daily routines and what we call behavioral activation, just getting them active and outside of the house, some practice in a safe way, and making it less of a big shift as they're going back to school to try to help reduce some of that anxiety before they get to school.
My son, 7-year-old, has always hated school and has been bullied there, which makes him anxious. At the same time, he didn't do well with home learning. He often got frustrated and would cry about not being able to do the work. There are negatives to both options, yes, and I don't know what to do. Why do you think kids learn better from teachers? He was happier at home, but cried more about the learning piece. Whew, lots of things there. So let's see. Why do I think kids learn better from teachers? Well, I think what parents have learned, at least I've learned through this whole process, is that teachers have special gifts. It's not just about the material. They have a way of being able to present material. And I go back to college even. There were some professors who could make the material come alive and could really help you learn it. And then there were professors who stood at the screen and just kind of read it off to you. So I think, there is a whole profession for teachers because they have special skills. So give yourself a break if that is not the thing that comes very easily for you. The best thing that we can do, though, is make sure that they're on a routine, make sure that they're doing work that is at their grade level and that they feel supported in that. So if we can involve the teachers as tools, then that is helpful if we're doing the virtual piece. If they're going to school, then again, let the teachers do what they are gifted to do and thank them because it's a tough job.
Yeah, and if you're concerned about the bullying, you know, it's important to be vocal about that to his teacher or bringing that up to administration if you need to, trying to find peers that he connects with and think about things that he's really interested in. And I know now is not the best time to get kiddos involved in extracurricular activities, but when you feel comfortable doing that, considering building up maybe his social group outside of school too. So there are lots of ways to still keep him in a safe school environment, so you're not feeling the pressure to help him learn, but continue to advocate for him. That was a great question. Thank you. Any other questions or areas that you would like us to touch on a little bit more? Okay. Anything else, Dr. Stuppy, that you're hearing in your office that you'd like our insight on?
Sorry, I moved, my mute button thing moved when you
Oh,
stopped
that's
sharing.
okay. I was just, you know, as a pediatrician, I'm sure you're getting a lot of these questions in your office. Anything else mental health-ish related that you think would be helpful for us to touch on before we wrap up?
I think anxiety is, of course, a huge one. I did see a ton of kids, especially older kids, get so much better sleep, and they are already dreading having to get up at dark 30 to go to school, like
Mm,
we have had in the past. They've thrived getting sleep on their own circadian rhythm.
right.
Um,
Yeah.
I know that a lot of kids are hesitant, like sensory stuff. So the mask,
Mm,
I really, really think if you haven't started working with your kids in masks yet, get them to like even touch it to their face for a few minutes and then put it on for a little bit longer. And if their ears hurt, search ear saver for mask. There's
mm,
tons of just buttons that you can put on headbands and stuff that help keep it off their ears if that's an issue. Because we're making kids wear masks in our office. And for some kids, it's great. They love it. They feel like they're superheroes keeping the virus away, but other kids really struggle with it. So a
yeah,
lot. Yeah.
that's great insight. Thank you. And yeah, for the sensory kinds of issues or anxiety, really the best treatment from a mental health standpoint is gradually exposing them to the thing that they fear or that feels funny, that's not what we would consider rational, right? So we want to, you know, gradually desensitize them or gradually expose them and let them know, hey, I'm in this setting, you know, nothing's bad's happening when I'm wearing a mask, or I'm at school and I'm able to have fun. Or can we completely get rid of the risk of the coronavirus? No, and we would never trick any child into thinking that. But we want to let them know that, you know, we want them to have fun, we want them to learn, and they can be happy and safe. And the anxiety is not going to make them any safer. Okay, well, I guess we will wrap things up.
Well, thank you both of you for joining us and coming and talking. And both of these psychologists are on the ADHD KC board, so they do a lot behind the scenes too. So I want to thank both of them for everything they do.
Thank you.
Yeah, just
Thank
thank
you all for
Our pleasure.
tuning in this evening.
Yes. Now go relax and put your kids to bed.
Yes. Have a good night.
Thanks.
Bye.
Bye.